The next speaker is Allison Crha. She's representing Oncology Nursing Society today and is an emergency department nurse at MedStar Georgetown University Hospital here in DC. She leads a hospital-wide council focused on advocacy, legislation, and health policy. A strong proponent of using her voice, she advocates on Capitol Hill for patients, nursing research, and nursing education.
Thank you, and thank you to Ms. Wilson for that incredible testimony for first responders. I wanted to thank the people that asked me to come speak here today, the Congressional Men's Caucus, Congressman Mullen, Congressman Payne, the Men's Health Network, and the Oncology Nursing Society for allowing me to speak. My name is Allison Crha, and I am a nurse. I'm proud to be among the 3 million nurses currently working in the United States. As nurses, we have the utmost respect for our first responders in the field, helping keep our community safe. First responders and nurses are linked together in the essential chain of teamwork to protect and save the lives of our community. And we owe them and the sacrifices that they make at large a large thank you. As we touch on the hazards facing our first responders in the field, I also wanted to make you aware of the hazards facing our first responders in the hospital. Working for the last 4 years in critical care and the emergency department here in Washington, D.C., it has been some of the most rewarding and difficult times of my life. But I was drawn to this profession with that same deep desire to relieve suffering for the people in my community. As an ER nurse, I have the privilege of caring for people during their most raw and terrifying days of their lives. And this is not a responsibility nurses take lightly. In almost all cases, a nurse was there when you breathed your first breath. And in almost all cases, a nurse will be there when you take your last breath. We serve as the largest provider of the healthcare workforce, 3 million strong throughout the United States. Not only are nurses the largest healthcare provider workforce, but we spend the highest ratio of time with our patients at the bedside. The TV media, like Grey's Anatomy, does not depict the reality of critical nurses as first responders. We are the ones administering that crucial dose of epinephrine. We're the ones with our hands on the chest, providing CPR. We're the ones racing to start your intravenous line when you're desperate for fluids. Many times, it is a nurse who notices the smallest change in a patient's condition and noticing that subtle downturn will most likely save a life. Due to our closeness with our patients, we also absorb much of the emotion in this current situation they are in. But that emotion is not always positive, and too often that negative emotion gets directed toward the very people that are serving you. My second day working in the emergency room, I witnessed a coworker get punched in the face by a patient. When Molly, a nurse, went to go educate her patient on why he wasn't receiving a higher dose of pain medication, he wound up and struck her in the head. She had broken teeth and required stitches. She fell to the ground. That happened on a Saturday morning, and Molly reported for work on Thursday, as she was scheduled. She came back to that same ER because she was passionate that nursing is something that she was going to devote her life to, and she knew that her dedication to nursing is why she came back. But my question to you today is, did that have to happen to Molly? These situations are not isolated to the emergency department. Up on our intensive care unit, a terminal patient was passing away. Emma, the nurse taking care of that terminal patient, was cornered in the patient's room and yelled at by an enraged family member who accused her of killing their loved one. Emma was trapped in that room with no chance of exit until a staff member intervened. In many cases across the country, nurses like Emma have not been so lucky. Incidences like these are not isolated. Between 2011 and 2016, the U.S. Bureau of Labor Statistics reported that 58 hospital workers died as a result of violence in their workplaces. 58. Healthcare workers in inpatient facilities are 5 to 12 times more likely to get injured than workers overall. Those statistics do not account for all the situations that go unreported and underreported. Violence against healthcare workers happens at large and small institutions, both rural and urban. Too many times, patients and families are taking out their suffering in violent and inappropriate ways. With drug and opioid use on the rise in our country, we can safely predict that incidences like these will only increase unless we take action. As you gathered, I do not have a 25-year resume of nursing experience. Yet, in just my 4 short years as a nurse, 2 of these events have already occurred in my personal life. I would make the case that in most careers, we'll never experience or see incidences like these. But what lies in store for the future of our nursing profession if these things continue? A profession that so desperately needs to attract more to its ranks. This epidemic of violence must be addressed. Currently, there is a bill, HR 1309, the Workplace Violence Prevention for Healthcare and Social Service Workers Act. This bill requires that employers develop and implement a comprehensive plan for protecting their healthcare workers from workplace violence. Through HR 1309, employers would be mandated to investigate workplace violence incidents and provide trainings for employees that might be exposed to violence. I'm lucky because recently my hospital has instituted a mandatory workplace violence prevention program. And as an employee that's put in high-risk situations in the emergency room every day, I feel more empowered and supported by my institution to combat these realities. But I do shudder to think about hospitals all across the country, large and small, urban and rural, that do not have these same protections. And so today I'm standing up and advocating on behalf of them. As nurses, we are a link in the critical chain of emergency response. Many times we are overworked and understaffed, depending on the volume of human tragedy unfolding before us. But like first responders, we must be there, at the ready, when you need us most. So this is the moment where we need you. You have the opportunity to strengthen and protect first responders by supporting HR 1309. By doing so, your motivation becomes one with ours to protect and to save lives. Thank you.